Hi, my name is Janto. I come here once again. Today I'm going to talk about the minimum qualification required for employment in the UK. And this video is specifically directed to our nurses who are internationally trained who want to join the UK NMC register. As per the information that came out middle of this year, around July, August, concerning the certificates you are required to practice. Foreign nurses seeking employment must first complete either a nursing degree or diploma, and that information still stands because when you visit the NMC website, it still says that for a foreign nurse to qualify to join their register, they must have at least 3-year nursing training, which is equivalent to a 3-year diploma in either Ghana or Nigeria or other countries, or your 4-year first degree program. In addition to that academic requirement, candidates must have a minimum of 1 year nursing experience. This experience helps to ensure the nurse associate or the midwife possesses the practical skills and confidence needed to perform their duties effectively when they join the register. Moreover, possessing a license in your home country is also a crucial requirement during this process. One, you must have at least a 3-year nursing education, which is a diploma program, or a 4-year BSc or your first degree program. After this, you will need a 1-year working experience, and then you also need to possess your home country license. With these three, you qualify to register as a nurse here in the UK. The license you have from your home country serves as a formal recognition of your competence that allows you to practice legally in the UK as well. Finally, also have your English proficiency exam taken, either the OET or the IELTS. Any of them you take, you are required to bring a certificate of that to show a strong communication skills when you join the NMC register as a nurse, midwife or nurse associate in the UK. You need to also have, aside these qualifications, a strong communication skills, which is also vital in the healthcare setting, ensuring clear understanding between nurses and patients as well. In summary, to join the NMC register as a foreign nurse, you need to complete a nursing degree, either nursing degree 4 years or a 3-year nursing program diploma, and attain at least 1 year nursing experience, and also have an active license from your home country. On top of that, you need to also pass your English language proficiency. Now here is the twist. In the middle of this year, that the Home Office brought some information regarding the criteria they will use to employ skilled workers from foreign countries. Here is where the twist comes in. People are on the side that information doesn't really concern or doesn't really cut across when, or doesn't affect nurses. And there's another school of thought or another group of people also arguing that once they mention skilled worker visas and nurses are also skilled workers, it cuts across all of us. But here's my take. Now, those saying nurses are not part of that requirement, that is, you need a minimum of a degree or a first degree to gain an employment in the UK. The regulatory body which regulates what nurses and midwives in the UK has stated their requirements for joining their register. That is the requirement you might meet to become a nurse, and that is what I said earlier. At least 3 years nursing degree or your first degree, which covers 4 years. That one is one of the premium requirements you must meet. This comes to the fact that if you have your diploma from your home country, you still qualify to join the register. Then on the other side, if nurses are part of that information that came earlier, that you need to have a degree, then there is this conflict that will exist between the regulatory body, Nursing and Midwifery Council, and the Home Office, which I don't think that's going to happen. That leads to the fact that Those people also saying that that information doesn't affect nurses entirely tends to be somehow true. That is what I think per the assessment or the explanation I just gave. The body that is overseeing the practice of nursing in the UK is saying you need at least 3 years nursing program to qualify as a nurse. And then the Home Office is also saying another thing. Then if these two criteria exist, then there will be a conflict, which I don't think that will happen. In this case, it also makes me believe or accept the fact that nurses with diploma can still join the NMC register and then apply for jobs. After this news, I went around various job sites searching for the criteria for picking or accepting what prospective candidate for interview and in turn giving them job offers. And most of these job vacancies still list one of the essential criteria as having a diploma or a degree in nursing. This still confirms the assertion that if you still hold your diploma, you can still get a job in the UK as a nurse. The targets was usually for the skilled workers who are on the adult, social and healthcare. If you are still on the process of joining the UK NMC register from back home, you still have a chance if you have a diploma or a degree. Don't stop the process. Keep chasing the dream and then become the dream nurse you want to become here in the UK. I repeat, NMC has not changed their criteria for qualifying as a nurse in the UK. It still stands as well, at least 3-year diploma program or your first degree certificate. In case you are in doubt, I believe this video will clear some doubt. You may also seek further information regarding these processes, but I can confidently tell you that if you're a diploma nurse midwife, you can still qualify as a nurse in the UK. And so the Nursing and Midwifery Council UK changes that criteria. If they change that requirement that in order to join their register, you need to have at least 4 years nursing education, then that automatically rule out what? Diploma nurses from joining the register. If NMC allows a diploma nurse to join their register, and then on the other hand, visa requirement is refusing them to practice in the UK, then that conflict again rises. And I don't think this conflict is yet in situ. Please continue your process if you are on that journey. If you have not started yet because you heard this news, please, you can start now. My name is Chantal. What do I do? Thank you.